I'm here tonight to talk about sort of how to interact with your kids when you're talking about things related to trauma, particularly their trauma. Uh, so it's not the most cheery of topics, but it's a part of life sometimes, and I think it's a useful skill to know how to do because they're not easy conversations, and they're normally very emotionally charged for both your kids, but also for us as parents. A little bit about myself. I've worked at Linden for just over 6 years now, and I started there back when I was a student. Um, I've worked in our middle school mental health program. I then did my pre-doctoral internship with Linden in our self-injury program. I did my postdoctorate in our adolescent inpatient unit, and then also our adult inpatient unit. Once I was done working inpatient, I worked in our chemical dependency addictions program with teenagers. And then finally, I'm now the lead clinical therapist of our PTSD program that we offer at Linden. I went to school in Chicago for my doctorate, and I have two kids of my own. My son is 9, my daughter is 7, and I live here in Naperville with them and my wife. I have a 2-minute commute, so I am close to Linden myself. The topics that I am hoping to cover tonight while we're all together um, is the first, what should you expect from your kid after a trauma happens? I think that's one of the most common questions I get from parents that I work with. How do you talk to them without making it worse? Because I think that's what every parent fears is that they are going to somehow worsen what has happened for their child. And then how do you help them get better? What are ways to help your kid get through it? Um, so kicking it off with what you should expect from your kid after trauma, I think one of the hard things to know is what trauma even is in the first place. It boils down to trauma is when something has happened that has some kind of harmful effect on a person. Okay, so like in a medical sense, uh, a trauma could be something as simple as like a scratch on an arm. It causes trauma to the tissues. In a profound sense, it could be something like you break a bone, you break your spine, you have like a brain injury. Those are kinds of physical traumas as well. Um, the thing that makes it a trauma is that it was harmful to the person, and you don't just snap back from it. It'll take time to heal from the harmful effects. And just like physical traumas, trauma can also be emotional or psychological. And when something is traumatic in a emotional or psychological way, it's the same thing. It's something that has caused some kind of harm to the person, and it's going to take them time to heal from it. The healing isn't physical in that sense; it's emotional or it's psychological, but time is needed regardless for healing or recovery. Usually, a person's response to trauma is going to be intense and distressing. I think the thing I always want people to know is that that intense, painful, distressing reaction to the trauma, to the event, is not pathological. It's not something wrong with the person. It's not something wrong with your kid. That kind of intense reaction when something bad happens, that's normal. That's human. If you take anyone else and put them in the shoes of people who go through trauma, it's very likely that they would have a similar reaction to it. I think people worry that something is wrong because of how painful it is, the emotional fallout, the emotional reactions. Um, a lot of people will describe things like I feel broken, I feel like I lost a part of me, I feel like I'm different, like I'm never going to be the same. And all of that is just a human reaction when something terrible happens. What those things can look like specifically, as you can see by this slide, I, I mean, everyone will present with a slightly different trauma response. Okay, people might lose hope for the future. They might have psychosomatic, like body-related issues, like they get upset, their stomach gets upset. They might lose their appetite. You might not be able to sleep. You may feel detached and distant from your loved ones. You might cope in really unhealthy ways, like turning to, drugs or alcohol, or turning to self-injury. Um, some people might throw themselves into their schoolwork, their homework, their job, and try to constantly stay busy and never let themselves not be busy. So there are countless ways that a person might respond to a trauma. Um, Whatever those responses are, it's usually a person's best attempt at feeling okay when something not okay happened. Um, a traumatic stress reaction, something that's important to keep in mind is that you should heal from it over time. Um, Having a stress reaction to trauma is normal. Okay, it's healthy. It's part of the human condition. What isn't normal, and yet it happens to about 7% of people in the US, is when it's several weeks later, it's several months later, and yet the person or your kid still feels like it happened a day ago. Okay. Going back to that example of a physical trauma, if someone were to get a scratch on their hand or their arm and they bled from it, that wouldn't be weird. It's normal to bleed when you have a scratch. What would be very concerning is if that scratch didn't heal or it didn't recover, and a month later it was still bleeding. People would worry about that. That would be very strange. PTSD as a condition, as a diagnosis, is when something happened weeks ago, months ago, sometimes years ago, and yet it doesn't seem like anything has gotten better. For your child, or for the person who has PTSD, it still feels like the trauma happened a few hours ago, a few days ago, despite a long length of time since it happened. Once PTSD is a part of the picture, okay, if someone isn't recovering from a trauma and they're sort of frozen in that trauma reaction and it becomes chronic and it's PTSD, something that not many people know is that the average length of time for those symptoms to go away is about a year. Sorry, about 30 years, I should say. So unless PTSD is specifically treated, you're looking at half of somebody's life being characterized by those symptoms, and then having to learn how to cope with it, how to navigate it. I talk about the treatment of PTSD a little bit later in the presentation when we go over how to help. Um, but the distinction I want you all to be aware of on the front end here is not all trauma reactions are PTSD. Someone has PTSD when they're stuck, when they aren't healing from it. That's what post-traumatic stress disorder is. Um, One of the reasons trauma is so disruptive to a person's life, why it can really echo into other areas of your child's life or your life or whoever you know's life, is it changes the way we see things. Trauma will change how a person views their own safety. It'll change whether or not a person believes that they can trust other people, whether or not your child believes they can trust you or their friends. It'll change a person's self-esteem. It'll change whether or not they feel valuable as a human being. And sometimes these changes are very painful, they're very intense, and they're confusing. And it takes time for a person to sort of figure out what it all means for themselves. Typically, when a person heals from their trauma, when they recover, uh, however they do it, they're able to make some kind of sense of what happened to them in a way where they don't feel like they're the bad thing in the story, rather something bad happened to them. That's very difficult to achieve for some people because of these changes in their viewpoint. Um, but I think the takeaway here is what we say after a trauma happens can have a really big impact. Okay, it's those conversations after something bad happens, after something traumatic happens. There's a lot of risk, um, and saying the right thing, unfortunately, is not always a way to fix the pain that the people we love are in. So that sort of segues us to, how do I talk about it when I become aware of it? What do I say? How do I not make it worse? I think the key thing here, when your child shares something with you, um, that that they have found traumatic, is that we're willing to listen. Now, particularly when it's our kids, um, every parent that I've ever worked with feels the pain that their child feels in a really intense and visceral way. And so finding out something bad happened to our kid, um, is essentially the same thing as something bad happening to us. But in those moments right after our child shares something or we become aware of something traumatic having happened, what's crucial is that we we slow down and we hear what they're saying. Um, Sometimes that can be hard because, like I just said, their viewpoints might be radically different than before the trauma occurred. Okay, so those perspectives that your child shares could be incredibly stressful for you to hear. Um, eh, but you want to try to understand what they're saying and the way that they're saying it, the way that they mean it. Because your child, especially if they're young, they may not have the words to express themselves effectively, and you might hear them say things that don't make a lot of sense to you. So asking clarifying questions, trying to make sure you know what they mean so that it makes sense to you the way it makes sense to them, I think is the most important first step in talking to them about it. Um, it's helpful to let your kid know that you're ready to listen when they are ready to share. Okay, and I'll talk a bit more about this, but your child may not be ready to share right away. So even if you don't know what has happened or all the details of what has happened, it can be very helpful to let your child know I'm here when you're ready to tell me. Um, you want to let your kid know that you want to hear what they have to say, and it's okay to be transparent about the feelings that you're having. You don't have to walk on eggshells either. Um, so if you have an emotional reaction, you just want to talk through that with them. Giving space creates a feeling of safety for your kid. Um, I think one of the painful parts about trauma is a person's sort of instinctual response to it might be to pull away from people who they love, from people who they're close to. What this might look like is, a child might shut down. They might get very cold, very quiet. And I hear a lot of parents say things like, I have no idea what's going on for my kid. I don't know what they're thinking. They're not talking to me. Some kids who go through trauma uh, don't get distant. They get really hot-headed. They get very fiery, very angry, very combative. Um, and they might try to fight for the space that they want. So they may lash out, they might yell or scream, Sometimes with really intense trauma reactions, kids might try to run away. They might punch a hole in the wall. Um, and I think it is natural and human for parents to want to talk about it, to want to fix it for their kid, to make it better the same way we made other things better when they were younger. Um, Sort of like when you're trying to get a animal who's scared to come to you. You know, if you're out and a bird lands a couple of feet away, or there's a cat you're trying to get the attention of, you know, the best way to get someone to come to us is to be still and to be safe. You don't want to scare them away. And so when your child is struggling with opening up to you, when you're hoping to have a conversation about it, sometimes the best way to get them to talk is to take the pressure off of them having to share or having to talk. Making this sort of space increases the sense of comfort, and doing so will increase the odds of them being open and vulnerable with you. Um, a lot of times when I'm talking to people about their trauma, because that's pretty much my day job, um, I'll work with either kids, sometimes I work with adults, and they don't want to give the details. Um, I think the important part these stories is your child themselves. And so letting them know that they're okay, that you love them, that you're here for them, and that they do not have to share with you, uh, but you're open to them sharing. You hope that they do, will increase the odds of them coming to you down the line. Um, Sometimes that might not be immediately, depending on what happens. Sometimes it can take a few days, a few weeks, a few months, um, but not making that the priority is the best way to meet that goal. It's okay for you to have a human reaction. Okay, the things that you find important, the things that you want for yourself as a mom or a dad, is also important in this equation. And I think every parent I've ever worked with wants to ask questions. They want to know more. Um, you've got to be prepared for your child's pain when you have this kind of conversation. So if your kid is scared, if they're upset, if they're sharing those hurt perspectives that's coming from the trauma, the more you prepare yourself for that, uh, the easier it's going to be. Okay, I've seen a lot of families start to have these painful conversations about trauma, and then it's easy to get sidetracked by extraneous issues. You know, your child might be disrespectful or they might be mean, and when everyone has hurt feelings like that, it's easy to want to talk about that instead of the thing that you're actually there to talk about. If you want to ask a question or if you want to say something, I don't think it's helpful to avoid that. Okay, so it is okay to ask your child the questions that you have on your mind. Um, it's okay to ask, you know, why didn't you tell me? Or why didn't you come to me? Or who was it? You know, your child might not be prepared to answer, and they might have something that they say out of a place of pain. Um, but them knowing what you want to know creates transparency, it creates safety, it lets them feel more connected to you. And I think the only thing I try to caution parents against is being careful not to insinuate that what happened was your kid's fault. Um, it's not the end of the world if that does happen, but questions like, why didn't you do anything? um, may not be helpful, uh, because there's a big chance your child believes things like that when something traumatic happens. It's sort of a human reaction to take the blame for something and put it on ourselves. The human brain wants to make reason of things. It wants to understand how it can avoid getting hurt again in the future. And so our brain will automatically sort of look for the role we played in what happened. And that isn't just happening for kids. I mean, it happens for most of the parents that I work with too. You know, I've had so many moms and dads say things like, um, you know, if I just did this, it wouldn't have happened. If I didn't let them go out, if I didn't let them talk to that person, if I was paying closer attention. But that's the same thing that I'm describing right here, where your family, your child was in a situation that no one deserved to be in. Um, Very few people, like no one knows that these things are going to happen. That's usually not the way trauma works. Um, it's an unfortunate set of circumstances, that is not the fault of your kid, and it's not your fault. So the only thing you want to be careful about is to not sort of take that blame on yourself. Hold on, I think I'm getting a bit of lag here. Okay, to take that blame onto yourself or to put that blame on your kid. Um, Aside from that, whatever you want to ask, whatever you want to say, don't be afraid to say it. Maybe it is the wrong thing. Maybe the conversation doesn't go well, but you're always able to circle back and clarify. You're always able to circle back and apologize. You're always able to come back and ask again when the time is better. And so it is more helpful for your kid if you say what's on your mind, if you say what you think, um, and you work through whatever that process is together. It can be scary to do that. But the flip side of the equation is your child is also probably very scared to talk to you. And so if you're able to push through the discomfort of asking the questions you want to ask or saying the things you want to say, you're modeling for your kid the exact same process that you hopefully want them to go through also. You know, we should want our kids to talk through these things, to process through these things. We want them to feel safe when they do it, and we want them to do it in their own time. So sometimes we have to set the tone and show them that it's okay to talk about. And then if it goes poorly, we slow down, we take a step back, we try again later. Speaking a little bit more about blame and fault, the thing that I try to teach my patients, a very important concept is sort of as a society, I think the way we're all raised, um, we usually will think of blame or fault as a binary. You know, it either is my fault or it's not my fault. Either is that person's fault or it's not their fault. It can be helpful to take a slightly broader perspective on this, and to view things with three layers. It's not my fault. I played a role in it, and it is my fault. Okay. The language that I use, when I'm doing work with kids, uh, is that something can only be your fault. You can only be to blame for something if you mean for it to happen. Okay, if you intend for it to happen. Um, if I, for instance, you know, I've got my cell phone here. If I snapped it in half, that's my fault because if I'm doing that with my body, I meant to do that. You know, I'm in control of my hands. If I dropped my phone off the desk because I wasn't being careful and it broke that way, that would be my responsibility. You know, I would play a role in my phone breaking, but I didn't mean to break it. It was an accident. And there's a difference between doing something on purpose and doing something by accident. Context is important with these kinds of things. The example that I'll normally use is actually like if I swerve my car up onto the sidewalk to hit a pedestrian, that is clearly my fault. If I take my eyes off the road and someone runs into the road and I'm not looking and I accidentally hit them, that is still my responsibility for not having my eyes on the road, but I didn't mean to kill them. That's very different than if I swerved my car to hurt somebody. Um, it's important, I think, to make sure you have this frame, this idea of what a responsibility is and what a fault is, or what who's to blame. Because as parents, when something bad happens to our kid, we're very quick to blame ourselves. Um, our children, when something bad happens to them, they're going to be very quick to blame themselves as well. Um, I think the reason we jump to the conclusion as people that something is our fault is because um, we don't usually think of it through this lens that I can play a role in how things play out without meaning it to happen. Um, when someone's responsible for something, you still want to hold them accountable. You know, if I did accidentally hit someone with my car, I still want to take steps to fix that or to make it okay as best as I can. If I do something accidentally to hurt someone who I love or who I care about, I still want to apologize and say I'm sorry and try to make up for it. Um, Responsibility doesn't mean that you don't grow or learn from the experience. And I think that's the painful part of this is people can see their own role that they play. You know, parents, we see the role we take in our children's life. Our kids see the role that they played in making a decision that led to something bad happening in some form or fashion. And we assume that that role we played must mean we're at fault. But unless we meant for it to happen, unless we knew it was going to happen and we did it anyway, it is not our fault. It's not our child's fault. Um, it is only the fault of the person who intended to do something bad, who meant to hurt someone else or to cause something to happen. So, with all that in mind, how do we help our kids get better after something happens? You know, we're talking about it, we're listening, we're giving space when we need to give space. Um, there's a bit of a distinction here between when you find out what the next step should be. Okay. If the trauma has recently occurred and it is fresh, it's brand new, and it's something within the last couple of weeks, within like the last month or so, the priorities you want to make as a parent is creating safety, consistency, and transparency for your kid. Okay. And when I say safety, I do mean like literal physical safety. You want to remind them that they're safe. Because after a trauma, depending on the context, but after most traumas, people feel unsafe. They don't think they're safe in their own home. They don't think they're safe in their bedroom. They don't think they're safe with other people. It's a stress reaction. It's the body's reaction to threat. Um, you can ask them how you're able to help with this. They may not always have answers, but if your kid doesn't feel safe, it's okay to ask them if there's something you can do to help them feel that way. Um, One of the things that you want to follow your child's lead on is whether or not they want touched after something bad happens. Okay. Because physical touch can be really stimulating. If your brain thinks there's a threat, getting touched can be really scary and off-putting. I think as parents, what we desperately want is to just scoop our kids up and protect them from the world and tell them they're okay, um, and not let anything bad happen to them again. But that parental urge to keep them close, sometimes literally, and to hold them close, um, you want to make sure they're okay with first. And if they're not, to give time, to give space can make a world of difference. What I mean by consistency is that routine is helpful. Okay, spending time together as a family, spending time one on one with your kid, um, doing things that are literally enjoyable, like going for a walk together, eating together, cooking together, playing a game together. Things like this are critical. And the consistency piece is you want it to happen in a predictable, ongoing way. Okay, so um, if you become aware that something bad has happened to your kid, um, doing things on a regular routine can be huge for helping them recover and to move through it. The one of the questions that I get from a lot of parents is like, should I still be expecting them to do chores? Should I still expect them to go to school or do their homework? And I think the answer for that can be it depends. Okay. Your child, every child's different, every situation is different, but having a routine and having consistency can help a lot. So if your child isn't sure that they want to do their chores, you encouraging it and helping them along with it, even though they're in pain, can be one of the best ways to help them, get a sense that life is okay again. So you want to be flexible with the way you approach some of the consistency. You want to be thoughtful. You want to talk about it with your kid and other people, but you don't want to back off of every expectation either. So when I say consistency, I don't just mean the fun stuff. I also mean the stuff like brushing your teeth, taking a shower, cleaning your room, um, and still holding your child consistently to those expectations that they had before you became aware of the trauma. And then what I mean by transparency is you want to look for opportunities to have a natural conversation. All those things we talked about with the listening, how do you actually talk? Um, you want to let them know what you think and feel. You want to let them know, uh, if something bad happened, it wasn't okay that it happened, that you didn't deserve it. Um, like I had said earlier, you want to be clear and you want to be open with your thoughts, and what's on your mind. Um, Sometimes that's going to require, in order for you to be honest with your child, um, you might have to take stock and try to be honest with yourself. Um, so if you're struggling, you want to make sure that you talk to somebody about it, that you have input from people who you love and who you trust, so that you know where you're at with this. Because if you're having your own trauma reaction, it can be a lot harder to support your child when they're going through theirs. Um, but the thing is, you don't have to hide the fact that you're doing that. Um, it is okay to be open about it. Sometimes your transparency and your openness, or your transparency and your honesty, that might cause stress for your child, and you might have tough conversations. There might be arguments. There might be moments where your child shuts down. Um, but the crucial part, the thing you want to look for as a parent is that it feels in some way productive. I do trauma therapy at the hospital, right? And after you start trauma therapy, it's not unusual for people to get more stressed. And so a lot of times after the first week of treatment, parents will call me and they will, let me know that their kid doesn't seem like they're doing too well. They seem like they're stressed, or that some of the symptoms that they go through seem to have gotten worse. However, sometime usually during the second week of therapy, after a little bit of time and their kid starts to heal again, there's usually a really emotionally intense conversation. It's almost like clockwork. Almost every family I work with has this process where, there'll be sort of like an argument or some kind of tension. Um, but then they'll tell me, Jerome, after we argued, I finally feel like I have my kid back for the first time in years. Right? I feel like um, they were really there with me. I've heard stories about like their kids will come and just lay their head on their lap and sort of cuddle on the couch for the first time in forever. And so the more you can model transparency and help your child understand where you're at in this process, the more likely they're going to be able to do that too. Those feelings are going to be really intense and really painful because after a trauma, people are in pain, but it'll feel productive. You know, ideally, it feels like you're getting somewhere, or that you did something good, even though it felt painful to talk about it. Now, in situations where the trauma happened a while ago, and you're sort of navigating a situation where even after several weeks, several months, your child is still struggling significantly with the traumatic event, and they don't seem like they've gotten better. It's possible that they've developed PTSD. Um, like I said earlier, it doesn't get better by itself. If you wait for it to get better by itself, you're going to be waiting until your kid is like in their 40s or 50s. Um, and so at that point, one of the helpful thing to do is therapy or treatment. It's going to be a very important part of the recovery to be able to do some kind of intervention with a professional. Now, something I want to caution parents against is if you were to like go onto Google and search up trauma therapist, you're going to get countless results. Um, there are a lot of people who are trained to be sort of a trauma informed clinician. Okay, but that is different than someone who specifically treats post traumatic stress disorder. If your child went through a trauma and they are still experiencing significant struggles a month later, you want to get help for them um, from somebody who is specifically treating post traumatic stress disorder. And it's okay to ask that professional questions about how they do it. Um, one caveat when it comes to therapy or treatment is your child, they might not want to. Okay, they might not want to go talk to somebody about it. I think one of the most human parts of post traumatic stress disorder is people just want their life to go back to normal. They just want to move on. What's unfortunate about that is when people want to move on, a lot of times they put on blinders and they put their head down and they just try to plow through their life. But that's not going to help anybody. However, if your child is refusing to do therapy, forcing them into it isn't going to be helpful either. Okay, so there's a balancing act. You want to encourage therapy, you want to encourage them to go to heal, to work through this, but you want to guide them in that direction, not shove them in that direction. Okay. Um, if they're saying no, you don't want to let it go and, and never circle back, never talk to them about it. Um, but you want to sort of regularly check in on if they're willing to do it and to try to talk through it with them about, how you might be able to make it better for them. Um, I work really well with a lot of kids, but I have to tell you, a lot of kids are uncomfortable with having a male therapist until they meet me, and then they're like, "You're not a guy. You're a golden retriever, or you're a squirrel, or a chipmunk." Um, but maybe your child wants to see a, a female therapist. Maybe they want to see somebody young, or maybe they want to see someone older. Um, Maybe they want to see someone virtually. Maybe they want to do it in a group. Maybe they want to do it by themselves. Um, Maybe their priority is I want to talk to someone, but I want to make sure that it's my therapy. I don't want them to talk to you or my other parent. So having those kinds of dialogues and conversations, if your child is refusing, can be helpful because then you might be able to find somebody that fits their needs. A little bit more about what you want to look for when you're trying to find some kind of help for your child is usually sort of in the therapy world, we split trauma therapy into these two categories. Okay, there's top down approaches and bottom up approaches. Um, a bottom up approach is things like somatic experiencing therapy or art therapy, movement therapy. Um, what these therapies are helpful for is a person, after they go through a trauma, it's not unusual for them to feel really tense. And people don't always know why. Our bodies might see threat and just be used to responding to that threat, even if it's not a real threat, like something bad's going to happen. And these kinds of therapies, they're designed to help a person learn how to open their mind, open their body back up to living life, to feeling comfortable in their own skin, feeling comfortable in the world. I think the helpful thing about these therapies, they're very good for the healing process over time, to just feel okay again. Um, Top-down approaches are usually more of a talk therapy, or a thinking therapy, and not so much a feeling therapy. Okay, the goal of these top-down approaches is that if we change what we think, or if we change what we believe, we'll change how our body feels. Um, I'm a doctor of psychology, so one of the things I have access to are like treatment recommendations from our APA. And something I do want parents to know is when it comes to the treatment of PTSD. So if your kid is struggling with symptoms weeks or months after the event has resolved, after the trauma has gone away and passed, you want to look for these kinds of top-down approaches. I think a really common myth or a really common misunderstanding when it comes to trauma is that it's with you for life. Okay, but like I said earlier in our talk tonight, if someone has a scratch, you expect that scratch will heal over time. If they break their bone, it'll take longer to heal than a scratch, but you expect the broken bone to heal. Um, Trauma is with us for life, but it doesn't have to be painful for life. Um, the treatment of PTSD does not take years. Um, in the program that we do at Linden Oaks, we have a program for kids and we have a program for adults, and we do cognitive processing therapy. And it's only a 3-week program. It's 14 business days, and only 12 of those are actually dedicated to the therapy itself. Um, PTSD is when healing gets stuck and your healing process is stalled, it's frozen. And so treating PTSD doesn't mean everything is going to be better about your kid. What it means is that your kid starts to heal again and they don't feel stuck anymore. You feel like they're growing, like they're recovering, like things are getting better. And a lot of times after a kid gets traumatized, PTSD becomes part of the picture. I'll hear families say, it's like a switch happened, and I feel like I don't have my kid anymore. They've been going through these issues and nothing seems to help. Um, Even if they've been in therapy, if they've done some of our other programs. Uh, but the good news is that once you get your child into therapy that's specifically for PTSD, they'll start to get better again. I think an important part of this conversation, a lot of times trauma can come from another person. And that can be a tough thing to wrap our head around or to talk about with our kid. And so there's a sort of a dilemma on when you're a parent and someone has hurt your child, what the right thing to do about that is. Now, as a therapist, when I'm talking to parents about this, what I want everyone to understand is that there's not a right answer. Okay. Whatever you think as a parent is best, ultimately that is only up to you. The thing I try to encourage, the thing I want people to know too, is taking what your child wants into account can be very, very helpful. Okay. Um, if someone has hurt your kid, I think it's a very natural reaction to want to make things fair, to get justice. But your child might not want that. Sometimes there's a window of time where you can act on these things and actually do something about it, and your kid may not be ready during that time period. Um, you are not a bad parent if you make a different decision than what your child wants. Again, there's not a right answer, but I do want to encourage that you talk to them and take what they want into account. Because when a trauma happens, regardless of what kind of trauma it is, there is a feeling of having lost control or lost their power in that situation. And so by collaborating with your kid, letting them be a part of that conversation, you're giving some of their power back to them related to the trauma. And if you follow their lead, there is no way to know if things are going to turn out okay, but it can help them feel like they have a say in what happens to them. And that is, I there's no other way to say it. That's just helpful for people healing when something bad happens. What I don't want people to confuse, that hope to make things fair, to make things just, that is not always the same thing that will help someone heal. Okay. And so in that decision making process, I would encourage prioritizing what's going to help your child heal as opposed to what feels like the right thing to do, what feels like the fair thing to do. Um, that will help your family as a whole move forward. Sometimes that does mean holding people accountable and doing everything you can as a family to make sure that happens. Sometimes that's not the case. We're sort of on the back end here. So I have a couple of reading recommendations for those of you who joined. The first one, all the way on the left, Getting Unstuck from PTSD, that is sort of a self-help book, but it's a very useful resource to guide people through the process of healing. Um, and it's exactly the kind of therapy that I do, sort of diluted into a manageable workbook. And so if you suspect your kid or you have PTSD from some kind of event, it can be a helpful thing to, a good starting place for helping things get better. Brainstorm is one of my favorite books because it gives sort of an overview on what a healthy teenager looks like. And a lot of times we focus on what's wrong. It's hard to know what right looks like, what okay looks like. And it's a book that is filled with useful tips about like, how do you talk to your kid about stuff? Um, what should you expect from your kid? How do you spend quality time with your kid? Um, how do you have a basic understanding of getting someone through their teenage years in a healthy way? Wise Minded Parenting is a book that is informed by a lot of the clinical practices that we do in the hospital. Wise Minded Parenting is a book that teaches you how to infuse your parenting with um, emotional regulation. How do you teach your kid how to keep themselves calm? How do you teach your kid how to get through painful or stressful situations? How do you help them communicate in a healthy way? Um, and it gives techniques, it gives tools for navigating those kinds of issues. After a trauma happens, it's very common, it's very typical for intense emotions to be a part of the picture, and your child might not know how to navigate them. And countless parents don't know how to be there for their kid and teach them how to navigate them. And that's what the Wise Minded Parenting book helps you learn how to do. And then finally, Does My Child Have PTSD? Is a helpful resource, not necessarily for making PTSD better, but for knowing what it looks like and how to navigate those initial conversations, those initial hurdles and issues that every family is going to go through. So, with that said, that brings us to the end of the material that I have prepared for you all. I'll still be here if anyone has questions that you want to put in the chat, and I'll do my best to answer those.
Jerome, thank you so much. That was so insightful. We will open up, as Jerome just mentioned, the question and answer portion. So I'll take a couple minutes for you guys to chat your questions. See if we have any coming in. All right, it looks like we have one.
Yeah, I see.
Oh,
Okay. So I see one question here, Kelly. What is considered trauma? So I, I think that's a good question. Because I gave a very broad um, sort of description of what trauma is. It's so just to recap it, it's when something harmful happens and it's going to take us time to heal from it. So, if we're talking a physical trauma, something as mild as a scratch is technically traumatic because you got to heal from the scratch. Something like breaking your bone, breaking your spinal cord, that's profoundly traumatic, but it's still a trauma. Not all trauma is sort of big and life-threatening or impactful in that sense. So, I think some of the healthy, more normative, more developmental traumas is like the first time you broke up with somebody in middle school and you were heartbroken over it and you couldn't listen to any of the songs that reminded you of them. that is technically a trauma, but it's not one of those profound ones that'll radically disrupt or alter your life. You heal from it quick, kind of like a scratch. You know, the first time a childhood pet dies, that's traumatic. You know, I think all of us here, if we thought of when those things happened, we still get sad about it. You know, like our childhood dog or cat dying, but we've recovered from it. Um, I know a lot of families, they're sort of like the thought or the conception that like soldiers get trauma or, you know, first responders when you're in a life-threatening situation. And those are certainly traumatic, but so are the things in our day-to-day life. Like a divorce can have a traumatic impact, but but that doesn't mean the divorce is bad. That just means it's going to take time to recover and heal. So traumas can be both big and small. You know, it could be the painful loss of a person we love. It could be a sexual assault. It could be war, but it could also be um, a middle school breakup or losing a job, things like that. Kelly, I think I saw you put a question in the
Yes,
chat. So
there was there was a second question as well that just came through.
um, with everything happening right now, there seems to be external trauma. So I'm guessing like things happening in the news, things happening like in the world right now. Um, I that can be a bit of a broader question. Like when the trauma doesn't happen to us or our families directly, but we're still all going through it as a society or, you know, as a group of people. Um, I'm a bit less equipped to speak on that, but you know, my personal hero is Mr. Rogers. He's someone that I looked up to as a kid, who I, you know, hope to be like in any way that I can. And you know, Mr. Rogers, he had an interview once where he said that he was watching the news and he was a little kid and saw bad things happening in the world. And he said his mom had told him that even when bad things are happening, you're always able to see the people who are trying to help. That there's always going to be people there trying to make things better. And so I think that might be my advice when trying to navigate conversations about the state of the world is that while the world does have many terrible things in it, there's no denying that. The world has pain, it has suffering. There's also good in it. There are people who are trying to make things better. There's people who love us, who care about us, who try to help us, and just reminding them of that too can be very helpful. There's another question here. Um, it says, I have a traumatized teen who seems stuck. How do I know how much to push and when to not? What I would encourage is that there's not going to be a right answer to this. I think every parent is afraid that they're going to make things worse. So I want to empower parents. I want to encourage parents. It's okay to talk about this kind of thing. It's okay to let them know what you hope for, what you want for them, what you expect. Um, that conversation might be really hard, but if you are coming from a place where you are trying to help, where you are prioritizing what's best for your kid, the chances of you making it worse are very low. Okay. That doesn't mean it's going to be easy. Your child might get very mad at you. They might have a panic attack. They might shut down. It might totally ruin the night. But the next day, you're both going to wake up and you're going to have another chance to try to talk about it. And you're going to be able to take what you learned from that one conversation and apply it to the next. So the only thing I would try to encourage is to not let it go completely. Okay, sometimes it might feel good to give your kids space, um, but to let them know where you're coming from and what you're hoping for is also important. And so I would say push, but then listen to your kid when they say, stop pushing, and then take a step back. But that doesn't mean take a step back forever. Wait a little bit, a few hours, a few days, and when it seems like things are okay again, you gently try to push again. And that might mean, I want to know what you want to do. I'm hoping if you could tell me a bit about what happened, I'm hoping you might go get help. Whatever it is you're pushing for, as long as you're there with your kid and you're working through it together, it's going to be okay. I think we have another question, the Q&A.
Yes, Jerome, can you see that? Okay.
Yes. Our daughter had something happen with a neighbor adult. My wife knew or had an intuition that something was wrong, even while we were away, and realized she was right once we returned to pick our daughter up. She's haunted by it. It was many years later before our daughter told us, what should we do for ourselves? Like I had said, I think it is very painful for parents to have something happen to their kid. And I think when we learn something traumatic happened to our kids, it's a trauma for us as well. So all the advice that I gave you all tonight about how to talk to your child, I would encourage you to use that for yourselves as well. Because as parents, we have our own healing process to get through. Therapy can be helpful, especially when I hear words like someone being haunted by what happened. That sounds a lot to me like the scratch hasn't healed. The trauma hasn't healed. It still feels like it happened a little while ago. And so navigating it, talking about it, go to my reading recommendations here. Getting Unstuck from PTSD is a very helpful workbook when that's the experience. Typically, the reason people don't feel like they get better is because their brain still sees the threat, still feels like we're in control of whether something bad happens again or not. And so working through those beliefs and coming to terms with the way we see the world, with the way we see other people, with the way we see ourselves in a way that is congruent and fair to us is how we heal. If we have beliefs like it's my fault it happened, if I was more careful, it wouldn't have happened, if I did something different, it wouldn't have happened, those kinds of beliefs can really keep our children and ourselves stuck and keep us from healing. But the hard part is you can't just tell someone it's not your fault. You have to authentically understand where that belief comes from before you can help change that belief. And that's what therapy helps people do. That's what, this workbook, Getting Unstuck from PTSD, helps people do. That's what I help people do in the program that we have at Linden. But that would be my advice on how to try to help with that. And I don't think I see any more questions. Kelly, do you see any?
I don't. And if anyone has questions after this, feel free to email them to lindenoaksmarketing@eehealth.org and we can get those answered for you. But otherwise, I will open up the poll. Thank you so much, Dr. Cole, and thank you everyone for being here tonight, and have a good evening.
Thank you, everyone. Have a good night.